I'm Mark Reed Edwards, Chief Marketing Officer at HFS. Welcome to this edition of Up Close with our healthcare and life sciences practice leader at HFS, Rohan Kulkarni. Rohan, great to have you back.
Thanks, Mark. Good morning. Good to see you.
It's good to see you. I know you've been out and about around the world, but it's good to have you back on the East Coast here in the U.S.
I am glad to be back on the East Coast.
So let's kick off with what you've been up to since our last chat. Where do you want to start? It looks like you've got a packed agenda.
I do. So we've published quite a bit since the last time you and I chatted. Let me run through the list, if you don't mind. To me, the biggest one has been the publication of our healthcare provider services top 10. It was a pretty extensive exercise. We evaluated 17 service providers. Optum, Cognizant, and Accenture were the top three, but I will say that the top 6 or 7 were pretty close in terms of their capabilities and the outcomes that they've been driving. A couple of other things that I'll call out here is that I found that there is a significant amount of convergence of service providers from multiple core competencies and heritages that they're coming together to solve for the triple aim of care, right? You got IT service providers, you've got consulting companies, you've got healthcare-only companies, BPOs, and all of them, but there is that kind of a convergence. And then, but the thing that I'll call out that I think there's an opportunity is that the go-to-market is still very legacy-oriented. I think there's a significant transformation and disruption occurring at the same time in America in terms of how care is being delivered, but our service providers are a little behind the 8 ball on this, but I've often seen that happens, and then they leapfrog forward. So we shall see. In addition to that, I'm kind of excited about finally getting to write about Metaverse and its impact on healthcare. Trying to figure out the hype versus the reality. But based on all of my research and conversations with a number of our HFS colleagues who are sort of deep into Metaverse and Web3 and so on and so forth, I will say that there are some reasonable use cases, but I don't think Metaverse is a fit for healthcare at this point in time. I'd love to be proven wrong, but I doubt it. But we shall keep our eyes and ears open in terms of how that evolves.
Yeah, it's one of those technologies where everybody feels they've got to jump on the bandwagon, right?
Exactly, and that's really the thread I was trying to pull to see if there was merit in healthcare for Metaverse, and I'm not seeing it as yet. Maybe there are other creative minds out there that might prove me wrong, but time will tell.
Yeah.
Mark, the other one that I'll call out is social determinants of health. We partnered with Genpact over the last 6 months, a very in-depth and unique study, I will say, where we included about 100 health plan CXOs and about 250 self-insured employers in trying to evaluate the commercial viability for social determinant of health solutions. The thing with social determinants of health is outside of healthcare, there is this general bias to abdicate our responsibility towards the government. We expect the government to be picking up. But unfortunately, that's not been happening, and we can see it in the outcomes. And so this study was to evaluate if commercial entities can actually get into this and make a buck while doing good to the society. And what we found, I'll give you the top line, is that between health plans and self-insured employers, they're willing to spend up to $500 per member or per employee on an annual basis. That is significant. That is significant because we're talking of over 120 million lives at $500 per on an annual basis. So that can add up very quickly. So I'm hoping this study will inspire a lot of the commercial entities to start developing and going to market with social determinant of health solutions. One last thing I will call out is around personalization of healthcare. We had the privilege of facilitating a very exclusive digital roundtable that included 15 senior executives from health plans, from health systems and life sciences. And we debated and discussed the personalization of healthcare by leveraging cloud and analytics. So this was sponsored by NTT Data and Snowflake, and we found that when leaders across the healthcare ecosystem come together, some really interesting and good things can happen. And so I've written about that, and I'm pretty pleased with that effort as well. And one last thing I'll call out is my colleague Mayank and I put out a data point of view that shows that a lot of our service providers are, I will say, following the Clayton Christensen's disruptive innovation model, and they're maturing their capabilities, enhancing the sophistication of their solutions, and are preparing to disrupt parts of the life sciences ecosystem. And especially, I think that we might see some of it happening with clinical research and even manufacturing to some extent. So that's what we've been up to these last 4, 5, 6 weeks.
Yeah. It's always great to hear what you've done in the recent weeks and months. But the thing that always excites me, especially in this space, is what you've got coming up in the next few weeks and months. Can you share a couple of things?
Absolutely. The future is more exciting than the past, that's for sure. So what I will say is that we just launched the 2022 Healthcare Services Top 10. I expect that we will evaluate anywhere between 25 and 30 service providers. So this is going to be an extensive study, probably one of our largest studies to date. We're going to be tracking multiple markets as part of the study. We'll look at Medicare, Medicaid, commercial group and individual insurance, as well as self-insured employers. And so the focus of the study, in addition to the markets, will continue to be both business services and technology services. So my expectation is that we will publish that around Thanksgiving or so. So that's what we are marching towards. The other thing that we are doing, and I expect that we will be publishing it fairly soon, my colleague Mayank and I are putting together a highlight about Amazon's acquisition of One Medical. Look, I am super excited about this because for a very long time, there's been word about retailization of healthcare and Amazon disrupting healthcare and blah, blah, blah. But finally, it's here. I am predicting that 2 things will happen. One, you and I and others, 100 million others who have Prime membership through Amazon will likely get free primary care through One Medical for the next 12 to 18 months, right? And 2, this will potentially force the disruption of health insurance for primary care in America. So I see significant impacts because of this acquisition. So we're going to write about that. We're also putting out a piece on the impact of recession on healthcare. My general analysis suggests that healthcare businesses in general are going to be immune because of will be immune to the recession. We've looked at data over the last 30 plus years across 4 different recessions, and the conclusion is recession or no recession, healthcare is going to continue to grow. Unfortunately, in some ways, given the fact that we human beings will always get sick, and so we do need healthcare. And then the last thing I'll call out is that as part of the healthcare provider services top 10, one of the findings that I took away is that except for one service provider, the rest of the service providers don't really have clinicians or a chief medical officer amongst their leadership ranks. And I think that they're potentially missing out a trick there, given the fact that clinicians are better positioned to sell to other clinicians, and I don't think they have quite embraced that. So we'll provide some of our perspective in terms of why they ought to seriously look at having a clinician amongst their leadership rank. So that's what's coming up, Mark.
Yeah, well, it's a packed agenda. It looks like a happy Thanksgiving for you coming up, right?
For sure, indeed.
So really, thanks a lot, Rohan. Always great to get this update from you. And to learn more, head over to hfsresearch.com. And thanks for tuning in, and we'll see you on the next HFS videocast.
Thanks, Mark.